नमस्कार, मी अमर शिंदे. माझे वडील अशोक शिंदे साधारण वय 56 वर्ष आणि साधारण 29-30 जूनला त्यांना दम लागण्याचा त्रास सुरू झालेला. त्यावेळेस आम्ही टुडिकोसाठी महेश सरांकडे गेलेलो. महेश सरांनी त्यावेळेस वेळेवरती निदान केल्यानंतर त्यांनी तेरणा हॉस्पिटलला ॲडमिट होण्यासाठी सजेस्ट केलेलं आणि त्यानंतर एक 8 ते 10 दिवसाची पूर्ण त्यांना स्टेबल करण्यासाठी प्रयत्न केले गेले.
This particular patient had severe aortic stenosis, which means he had obstruction at the valve which propels blood from left ventricle, that is main chamber of heart, to the aorta, which is main blood vessel of the body. So this is a very serious situation. In such cases we have got two options, either TAVI, that is transcatheter aortic valve replacement, which means we can replace this valve like angioplasty to the groin region or to the neck vessels, or aortic valve replacement, that is conventional open heart surgery. So he was perfect candidate for TAVI, but at the same time he had severe infection of the valve, that is infective endocarditis. That's why this patient underwent aortic valve replacement. Now he is doing absolutely fine.
मला सुरुवातीला धाप लागली होती, दम लागत होता, पाय सुजले होते, त्यामुळं चालायचा त्रास येत होता आणि एवढं नॉर्मलसाठी खूप हे व्हायला लागला, त्रास व्हायला लागला मला. मग नंतर मग डॉक्टरांकडे गेलो, डॉक्टरांना दाखवलं, डॉक्टरांनी योग्य निदान केलं आणि पुढच्या ट्रीटमेंटमुळे मग मी आता व्यवस्थित आहे.
The main challenge in this case was a low ejection fraction, that is low pumping capacity of the heart, that is his heart was pumping only 10%. In such cases diagnosis becomes very difficult. So this patient had severe breathlessness, swelling over feet, distension of abdomen, low urine output, and in such cases diagnosis is difficult. So he came on time and had proper diagnosis and underwent surgery on time. So it was good save. Thank you.